I'm really tickled to be here. I'm very comfortable in an audience like this, and I feel that I'm speaking to friends rather than speechifying on a glorious Saturday afternoon. I have enormous admiration for the Saskatchewan Council and the omnibus work it does with all of its individual partners, the umbrella role that it plays. They had managed to distribute some $350 million worth of projects since the inception of the Saskatchewan Council, and because so much of that is on the ground, deeply affecting the lives people lead, I couldn't but be tremendously impressed. And I guess it's as it should be, because in the province of Saskatchewan there is this extraordinary matching grant reality, which makes it so much easier to raise the amounts of money. It's tough to raise money for these compelling and international causes, but at least in Saskatchewan and in Manitoba there is some matching contribution. There's some matching contribution from CEDA as well. It's wonderful when you have non-governmental organizations that can take the monies that are contributed by Canadians and through CEDA and other arrangements and put them right at the grassroots, right into the hands at community level where it makes such a profound difference. I also like your emphasis on youth, and this being the International Year of Youth. And I agree with Vian. I agree that there's a kind of renaissance in the youth community in this country. There's a tremendous sense of struggling for social justice, of changing this world for the better. I've been lucky enough to be at McMaster for the last 3 years, and I'm going to be at Ryerson for the next 3 years. And I love the privilege of being on a campus and engaging in an intellectual exchange with students who are suffused by idealism and want to make things work and are prepared to take a chunk of their lives, if necessary, in the developing world, to be on the ground and to make a personal and vivid contribution to improving the human condition. I met with a number of young people in Edmonton yesterday, and they were demanding space. They wanted, both within schools and within the community, that the space be given so that the voice of young people could be heard. And you know, it strikes a tremendous resonance with me, because in the battle against the pandemic of HIV and AIDS, the weight of the response is increasingly on the age range from 15 to 24. Where fully half the new infections occur, and overwhelmingly, of course, occur amongst young women and girls who are so disproportionately vulnerable to the infection. And one of the great achievements of the last couple of years is the fact that the prevalence rate in HIV is beginning to stabilize and in some countries decline in the age range 15 to 24, as the young people of the society take on board the prevention messages which are absolutely fundamental to defeating the virus. And one sees over and over again in the power of young people a voice to alter the predicament of this world. And that, again, speaks to the phenomenon of civil society. And I love the fact that you've all turned out. I love the fact that civil society steps in where governments fail to tread. It's all in the service of building global citizens. It's all in the service of making the people of any society much more aware of, conscious of, the level of injustice that inhabits the planet. It's all a matter of taking hold of issues that go right to the viscera, go right to the soul of what's important, and immersing oneself and spending some time and doing the work and raising the funds and becoming members and joining NGOs and taking pride in what you can, through your collectivity, achieve. And I was very much taken when I read some of the material that you sent about the work you do in the schools and how in this particular year there was a focus on the Millennium Development Goals. And it occurred to me that that was a useful subject which I might address. When I read the posters as I was coming in, it said, "The world is falling apart, what role civil society?" And I was deeply animated by the poster, because it's always nice to read a poster that tells you what the subject matter is of the words you intend to disgorge. That's not the fault of the organizers. I absolutely am certain that I agreed to the title. It's just that I'm inching into my dotage, and I haven't always grasped as quickly as I should what it is I might address. But if I'm going to speak to the world falling apart, and it seems to me that the Millennium Development Goals are as good a central thesis as any. I spent all of last week in New York at the Millennium Development Conference at the UN, and in part at the Clinton Global Initiative, which was taking place simultaneously, addressing the same issues. Let me take a moment, if I may. This is an intelligent and interested audience. Let me take a moment, if I may, to parse what is happening. The Global Fund to Fight AIDS, Tuberculosis, and Malaria, certainly in all three communicable diseases, has been the most significant intervention the world has made in the last decade. It has provided more funds and made a greater difference to saving lives than any other organization, including the very significant presidential initiative in the United States called PEPFAR. The Global Fund, headed by an inspired and able fellow named Michel Kazatchkin, has asked for a minimum of $17 billion over the next 3 years so that they can maintain the present course of intervention around treatment and prevention and gradually, incrementally increase the value of their work and the impact it makes. But what they really want is $20 billion over 3 years so that they can increase the trajectory of treatment. You see, we've come a long way. There are now between 5 and 6 million people receiving antiretroviral treatment, triple combination therapy as it's called, taking 2 pills a day, 1 in the morning, 1 in the evening, sometimes just 1 pill a day, but allowing them to survive for a very, very long time. We don't yet know what the life expectancy is likely to be, but it looks as though it'll be very close to what is true for the rest of the population. And if we had $20 billion over 3 years, we could begin to treat on an accelerated basis the 9 to 10 billion people who require treatment now and are frantic that they won't receive it because the rollout will not be possible as a result of flatlining of budgets and reduction of dollars. And it's a matter of some consternation that it looks as though the Global Fund will receive not 17 billion, not 20 billion, but something like 13 billion over the next 3 years, which will be counted in human life. It will have a terrible toll on human life without the necessary flow of resources, which resources, I want to make the point, were absolutely promised and committed. This is a betrayal and a negation of what was committed as far back as the G8 conference in Gleneagles in the United Kingdom in 2005. And it has some people in the developing world, particularly on the continent of Africa, in a positive panic. And in order to get to the amount that was required and pay our fair share of world gross national product, Canada should be giving something in the vicinity of $300 million a year, not $180 million a year. And I say with surprise and dismay that even President Obama has been begrudging in the amount of money that's going to be given, and that has been mirrored in the French and the German and the Italian and the Japanese contribution. The G7 countries who should make all the difference in the world are not making that difference. And as I stand here, I want to say, and I have to say that I'm damn near out of control emotionally when I think about all of this. We have trillions of dollars available when it comes to finding money for stimulus packages or for bailing out the banks or for fighting a war in Afghanistan or for dealing with terrorism or for dealing with oil spills, but we can never find an infinitesimal smidgen of that amount as a response to global public health. And it's crazy. It's absolutely crazy.